The Gleason scoring system is a very subjective scoring system. It's based on the appearance of the growth pattern of the tumor under the microscope. Now, given that it's subjective, there have been a number of studies done to look at what's called the inter-observer variability and the intra-observer variability of Gleason score. What this means is the inter-observer variability is that if you give the same slide to two different pathologists, how many times are they going to give the same diagnosis? And it turns out that the inter-observer variability, in other words, one pathologist opinion versus another, is different about 35% of the time. Now, the other interesting thing is called the intra-observer variability. In other words, you give the same slide that a pathologist looked at, but give it to him on a different day. In other words, if you give a slide to a pathologist on a Monday and then give it to him on Wednesday and he doesn't know that he's looked at it before, how often is he going to have this come up with the same reading? And again, we find about the same statistics, is that across the board, about 30 to 35% of the time, the same pathologist looking at the same slide in a different setting will give a different diagnosis. So it's important, since it is such a subjective interpretation and you're making treatment decisions that can potentially affect your quality of life and your health outcome for years to come, that you get the best opinion. So if you're at all concerned about the pathology, I think it's a very good idea to get a second opinion.